Pleasant good night, and thank you for joining in again to another edition of HealthWise by the St. Kitts Nevis Medical and Dental Association. I am your host, Dr. Woodley. I want to thank you for spending your Monday night with us. It is indeed a pleasure, wherever you are, whether it's on YouTube, whether you are looking at your television screen. As per the norm, the association and this program, we try to educate or use this as a platform to educate our people, whether it's COVID, whether it's marijuana, whether it's asthma, whether it's stroke, whether it's LGBT. We are here to give you the knowledge because we feel with that knowledge, you can use it as a tool to empower yourself and make informed decisions as it relates to your health. We also use this platform to showcase and introduce you to our doctors that we have in the Federation. We give you an opportunity to get to know them and to interact with them. Our doctors who work 24/7, 365 days of the week, tirelessly, selflessly. Our phones are continuously on, whether we are sleeping, on vacation, wherever we are here to serve you. This program brings the hot topics in health. What is going on in health in the Federation, regionally and internationally. Tonight in studio, I have two doctors with me, two great minds, who have come here to discuss the stomach bug, something that we are seeing a rise in, going to the ER departments, the Poxon Medical Center, and Mary Chas, and the private offices. I have with me on the left, Dr. Yannick Henry, our pediatrician, and let me say he was the one who actually decided to have this show, as he noted that the numbers were increasing as it relates to diarrhea and vomiting as a result of the stomach bug. On my right, I have Dr. Lescott. She is a product of the Taiwanese system, medical system. She's actually the first doctor we have on our show who would have graduated from Taiwan. And I also want to let you, the public, know that Dr. Lescott is actually filling in for Dr. Pemberton, who was supposed to be here, but because of illness, he was unable to be here. Yes, we doctors get sick at times. So Dr. Lescott stepped up, got brave, and she decided that she would fill in for Dr. Pemberton. So without further ado, I will let my two panelists introduce themselves, and then we will go straight into the topic, which is the stomach bug is back. Dr. Henry, pleasant good night, and thank you for being here with us.
Hi, good night. As Dr. Woodley, who is the president of our St. Kitts Nevis Medical Dental Association, as she clearly stated, my name is Dr. Yannick Henry, the pediatrician, and we have seen a rise in the stomach bug. So it calls for attention and to advise the public as to what is going on and how to manage it even at home before going to the hospital or the private offices.
Thank you. And on my right, we have the lovely Dr. Lescott. Please to introduce yourself.
Good night, everyone. I'm Monique Lescott. As Dr. Woodley mentioned earlier, I am a graduate of the Taiwanese ICDF scholarship, and I'm very happy and pleased to be here. It's an honor to have the opportunity to step up to the plate and help out a fellow doctor who wasn't feeling well. So without any further ado, I hope we can have a steady and productive discussion, and we'll all learn together. And I'll let Dr. Woodley have the floor once more.
Okay, so we are going to have a look at this stomach bug. That is normally the colloquial term. And when Dr. Henry approached me and he said, Dr. Woodley, I think we need to do something because so many cases are flooding our ER, flooding Poxon Medical Center and Mary Chas. And what we were observing was that most cases, nothing was being done at home before going to these health facilities. So brilliantly he decided, you know what, this is something we need to tackle, something we need to go on the air with, and as usual, I just jumped at the opportunity. So Dr. Henry, what is this stomach bug? Why is it bugging you so much? What's going on?
Well, the stomach bug, as we call it, but in our term, the gastroenteritis is the term. That is gastro, which deals with the stomach, and enteritis, which deals with the intestines. It is a medical condition marked by irritation and inflammation of the gastric tract, in particular the stomach and the small intestines, as outlined before. It refers to as stomach bug or the intestinal flu, and it can affect anyone, children, adults alike. So this is what we call the stomach bug, because it's something that's affecting the internal organ, the gastric tract.
And Dr. Henry, what I want to highlight here, because I know in our colloquial parlance, if I must put it that way, we normally, when you say stomach, for most people, they mean the belly.
The belly.
So I am telling you, persons from all different walks of life, no matter the educational level, sometimes I have to make it clear that your stomach is inside of your abdomen or your belly. So as you're saying here, the gastroenteritis is an irritation or inflammation of the stomach and the small intestines mainly. Okay, that's great. So Dr. Lescott, in terms of causes, can you just go through for us, the different types, what is the cause? If there are many, what are they?
Okay. Well, from what I understand of the condition, it can be caused either bacterially, it can be caused by viruses, or it can be caused by a helminth, which is basically a large worm. The scientific word for the large worm would be the Strongyloides stercolysis. Sorry, if that's not pronounced properly. But in terms of the virus causes, the viral causing of the condition, you can have a myriad of viruses. You can have the rotavirus, the Norwalk-like viruses, the enteric adenoviruses. I think those are fairly common. The calciviruses and the astroviruses, the enteroviruses. For bacteria, the viruses constitute up to 70% of cases, which means that they're more prevalent. The bacterial infections, which constitutes like 10 to 20% of the cases, you have stuff like the non-typhoid salmonella, the enteropathogenic, sorry with the pronunciations, the Escherichia coli, Shigella, Yersinia enterocolitica, and the sugar toxins, the Vibrio cholera as well, Salmonella typhi, and the S. paratyphi. Also, we can also have 10%, less than 10% cases with microscopic worms, the, we call this protozoas, the Cryptosporidium, the Giardia lambelia, and the Entamoeba histolytica, right? So those are just briefly the causes, whether bacterially, virally, or microscopic worms, or even large worms. You can get infected those ways.
So Dr. Henry, from your experience, and I would imagine that we are doing testing, I am not too sure, but what we are finding in our system, does it corresponds to the breakdown here in terms of, the viral infection being the most common? If we are doing any testing here on island, I'm not putting you on the spot, but such is life.
In terms of testing, we should be. We should be testing because, especially in pediatrics, in children, one of the virus that's really cause gastroenteritis and especially diarrhea or vomiting is the rotavirus. And now the World Health Organization has organized where we could test for the rotavirus itself. And but I don't know And I don't think that we are testing for it. We are just treating as is. But as we go on further, we'll find out why one of them is viral and why it's bacterial. So as we go along, we'll find out. But we should be testing for the rotavirus as to have data and statistics, for further findings. For
further reference.
Yes.
So as Dr. Lescott just spoke to us about, those were the infectious causes. So those are, infectious. And of course, we have the non-infectious. So can you tell us a little about the non-infectious causes of gastroenteritis?
Well, the non-infectious causes, we have like fish poisoning.
Yeah.
We have those children that are lactose intolerant and those that are gluten intolerance. We have the NSAIDs, like the ibuprofens.
And that's something we love too.
And we love those things. And the ibuprofens also damage the kidneys. But
that's why we go through drugs.
But we have the drugs and we have the benefits and the bad for them. So NSAIDs could also cause gastroenteritis and the immunotherapy, like those children that are immunocompromised, like those that go through chemotherapies and radiotherapy. Also, those things could cause gastroenteritis. Persons that are under stress. Some persons will come and say, "Oh Lord, I have the diarrhea," and
I used to get it when I do exams. When you have exams, I used to get, "Oh my God."
Oh yes.
That was horrible.
When you're under stress, like children for exams and. For exams or for sports or for anything, competition, they say, "Oh my God, I feel my stomach," So those are the things. The stress causes it, and the botulism, which is typically due to improperly prepared food, and also in botulism, I also educate parents that children under 1 should not get honey. Children under 1, because it causes botulism in children under 1, and so we have to really try to eradicate that, because persons like to say, "Okay, well, we're not going to use the sugar, but we're going to use the honey." But honey is not to be used with children under the age of 1 year or 12 months.
Oh boy, back in the day, your grandmother would give you a little lime and honey.
We'll give you a little thing here and there, but
Okay.
And also the Crohn's disease is a typical inflammatory bowel disease, the IBD, that may affect any segment of the gastrointestinal tract.
So what happens really during gastroenteritis, Dr. Henry? What is going on? Why do we have, you eat something or you get infected, and then why we begin to have diarrhea, why we begin to vomit? What is going on?
Well, the pathophysiology, that's what
I mean, you don't have to get into,
we're going to just give it a little concise, because we deal with the public.
Yes.
So you eat something, and then the lining of the stomach has the acids and the mucous wall. The intestines has something that is called the villous brush border of the intestines. Just like a mop stick, like a mop. You have a mop, it's very bright, it's very new. And so then something spill on the ground, you use the mop, but you constantly using the mop, then afterwards, then you realize that the mop is not sucking up everything afterwards. Then you say, "But wait, something is wrong, And so it's just to give an example, just like the brushes that we have in the villous brushes borders in the intestines, it is the same thing. Once they are damaged, then there's no absorption of the food particles, and so everything stays there. Once you eat you drink the milk or you eat the sugar, it becomes concentrated, and so the fluids move from your cells out into where it's more concentrated, and so that is why you have the diarrhea. And also the release of toxins that binds to specific enterocytes receptors causes the release of chloride ions, or as we'll call it, electrolytes. So once we lose electrolytes, then that is when you have lethargic, that is when you have weakness.
I love that analogy that you gave with the mop, that you get a mop, and in the first instance, as you mop, you dry the floor within the first wipe. But then as time go by, you realize you're using the mop, but you're not actually picking up the liquid off the floor. So this is exactly what is going on inside of the intestine. So that brush border then becomes ineffective. So you no longer can absorb the liquid in the lumen or the opening of the intestine, and that is where you end up with the diarrhea.
Diarrhea.
And then the irritation now would actually sometimes cause you then to vomit.
Yes,
to vomit as well.
Yeah.
Okay, makes sense to me. I'm here learning to it. You know, I'm into surgery. I just do a lot of cutting. That's why I like these topics. Honestly, I do. I do. So, Doctor, Lescott, signs and symptoms. What do or what should we expect? You're going to speak to a mother who, say, comes to your office, and she would ask you, Dr. Lescott, what are the signs and symptoms of someone who's having a gastroenteritis? What should I look out for? And what would be your response to that 19-year-old mother who comes to your office?
Okay, good question. Well, the general signs and symptoms. I don't think it's different for the adult and the child. The general signs and symptoms would be like abdominal cramps, the nausea, the vomiting, the diarrhea, the fever, things like headache, dizziness, loss of appetite, fatigue, and tiredness. Now, when it comes to the diarrhea and children, we have to be very careful about the dehydration aspect of it. Not trying to jump forward, but...
No, that's great. Let me get slide 7, please.
We have to watch the dehydration because through diarrhea, a lot of liquid is lost. So then sometimes what would end up happening sometimes, the child now, that would increase the lethargy. For instance, if they're losing fluids and electrolytes, you would realize that they probably will have low mood, low affect, low activity. We can test for dehydration in children in the mucosal lining of the mouth, whether it's sticky, whether it's completely dry. We have to test the eyes. We look at if the eyes are sunken, how sunken they are. The skin turgor. If we pinch the child's skin, if after we pinch it, we realize that the area that we pinch still has like the hooded effect or the mountain effect that we pinch, then we know that the skin is severely dehydrated. Stuff like this we look for.
And this is very important. And Dr. Henry, I want you to zoom in, because I know back in the day, especially things like cholera, I know many years ago, you know, many persons would die from cholera. And they were not dying because they were infected by the cholera. They were dying because of the dehydration. So I really want you to rub it in, highlight it, underline it in red, red, red. The importance of treating diarrhea and vomiting, especially in the young and in the old. So I want you to go over that again for me and let the public know the significance of not treating diarrhea and vomiting,
especially in children,
on time, especially in children.
Yes, it is. Dehydration is one of the most severe complications of vomit and diarrhea. Once you're losing liquid, the child is losing liquid, losing electrolytes. As Dr. Lescott said, the child becomes sluggish. And also, once you're losing the electrolytes, you're losing the potassium. Then what happens to the heart? The heart rate increases. And so sometimes it could go into shock. Once you're losing fluids, the child also could go into hypovolemic shock, which is low fluids inside of the body. So the brain now is not going to get everything. The brain, the different organs like the kidneys, the liver, will not get that fluid that transport the oxygen that will be needed for that child or that body to do what it's supposed to do. So in dehydration, there is a score. You look at the appearance, you look at the eyes, you look at the inside of the mouth and the tears. We go and we do a score. This is what these are things that parents could do at home.
And I want for you to really, you know, drive that point home. Because what we are realizing, and I don't mean to cut you off, is that I know parents get, you know, afraid, they get anxious, but you yourself can help out the situation.
Yeah.
Okay, and this score is something very simple. Very simple. And I want you to explain it to us properly, please.
Because we have the features and we have their scores, 0, 1, and 2. In appearance, if the child is normal or less energetic than usual, we give them 0. Less energetic, or a normal child that had maybe 2 or 3 diarrhea or liquid stool, because we don't classify it as diarrhea unless it's 3.
So unless it's 3.
3 or more.
In 24
in 24
hours.
hours. That is diarrhea.
That is diarrhea.
Okay? So, the appearance, if the child is restless and irritable and low energy, irritated as mentioned, that's a score 1. Drowsy, limp, cool, sweaty, not responding, is not responding to your stimulus or not responding to your voice, then that is 2. Then that is a severe case, then you know you have to run.
You have to run.
The eyes. If the eyes are normal, if it, with a child that has vomit and diarrhea, the eyes are normal, they are not slightly sunken, but they are normal, that's a 0. If they are slightly sunken, you give them 1 point. If they are very sunken on the inside, then you give them a 2. That is where you run.
That's when you run.
As you see, when to the public, when I say run, is when we say 2. Not when you're in 0, not when you're in 1, right? Because then you go through stress and you stress out the child itself, himself. So we have the inside of the mouth. When it is normal or moist, you know, you see the little spit and it is normal, it's not thick, then that's 0. Once it's sticky, then you give a 1. Once the child is dry and thick, then that is where we become concerned, because that child is really severely dehydrated. And going back to the eyes, if the child is crying, you pinch the child and there is no tears like normal, then you know the child is dehydrated. And the tears, which is normal, 0, and 1, which is few tears when crying, and no tears at all, that's number 2. So you add up all of those. If the child appears okay, still have vomiting and diarrhea, but no dehydration, that's 0. Between 1 to 4, when you add up all of your scores, so if you get restless and you get a normal eye and you get a sticky and you get normal tears, then that's 1, 2. So you know, 1 to 2, between 1 to 4, that's normal to moderate.
Okay. Mild to moderate.
Mild to moderate, sorry. If you add up your scores and it's 5 to 8, then that is severe dehydration. That is when you go to the emergency room for the child to be rehydrated or the child to be seen at the emergency room. Please note that children who are affected by gastroenteritis can become dehydrated quickly and can lead to death. So dehydration is one of the severe complications of gastroenteritis, especially in children, that we have to look out for. And these are the stuff that we have to look for. And especially if you have a young child that is below the age of 1 under 12 months, you know you have the soft spot. Some parents are afraid to touch the soft spot, but it is very important too, because once it is soft and it springs back, then that is normal. But once you touch it and it's sunken, depressed, then you know that child is dehydrated. And also one thing that we didn't have on the slide, we have to look for the capillary refills. Capillary refills is very important in children because the capillary refills, they are normally less than 2 seconds.
And what is capillary
Capillary refills is when you pinch the fingertips, then you pinch, you see a little white spot, then it turn back pink one time. That is capillary refill, right? The blood flow back to the fingernails as quickly, less than 2 seconds. But in a dehydrated child or person, it will stay longer.
But Dr. Henry, I mean, a 19-year-old or 17-year-old mother, no, even a 35-year-old mother would say, but Dr. Henry, I can't deal with all this quoting. I just need to know when I need to run to the hospital. I cannot deal with adding up 1, adding up 2. So, Dr. Lescott, what would you tell them? When do you tell them, okay, let's go to the hospital?
I would tell
When do you take your child straight to the emergency room and say, do not stay home? Because some persons may have a difficulty in adding the scores, and I can imagine sometimes a young mother who may not be too versed on all of this and want to add, and she would just say, no, I need something quick. I need something that is, practical for me. So when I see it, I can just go to the hospital. Sure. So what are some of the things you would tell a mother, probably a mom for the first time, a young mom, or somebody who's just afraid and can't do all of that adding? What would you say to them?
Can't do all of that adding, okay. For sure, I understand where you're coming from. It can be quite stressful, especially if the baby is fussy and you're flustered as well and you're also under pressure. So some conditions you should note to run to the emergency room if you notice these things happening. You should be very concerned if the child has not drunk any fluids for like maybe 4 to 6 hours. That's concerning. That's something you need to take note of. If there is any sort of severe signs of the dehydration that we just outlined, like there is no tears when the baby cries, there is dry mouth in the mucosal lining, there is sunken eyes, those are just like, you can see things like those things at a glance. You take them to the emergency room. Signs of any mental confusion, that's a very serious one. Any dizziness, any headache, any general malaise. If you notice the child is not their usual self, if they're very energetic and then they're now low energy, low affect, fussy, not cooperating, something is wrong. Also, we need to pay attention to the severity of the diarrhea, if there is any, how often, and the volume that the child might put out, if there is any blood or blood in the vomit or the stool itself, any sort of signs of any black stools, if the stool is too black, if the vomit is bright green, any chronic diseases, any underlying factors that the child might have, for sure. Any diseases that might have a weakened immunity effect. Something like stuff like asthma and stuff would tend to weaken the immunity of children. And if they're running any fever, any temperatures, that's like 38.5 and higher, or 101 degrees, 101.3 degrees Celsius. Fahrenheit, you take them to the ER.
Okay, and these are some good things that as parents, for parents who are looking on, that these are the things we have to make note of. I don't think, Dr. Henry, I don't think we have that problem here in St. Kitts, because every time I go through the ER, I'm seeing in there rampack, as we would say, and mothers. What I must say though, mothers don't hold up here in St. Kitts.
No.
As soon as sometimes you ask, how many diarrhea? One. You're in the ER with one? Yes, one. And I must admit, our mothers, they're quite on top of it. Sometimes, in fact, I would hear you sometimes when I'm passing through the emergency room, but Mom, what have you done before coming to the accident and emergency? And they would say, Dr. Henry, I am here.
Oh,
they had one, I got scared, and I showed up. But sometimes I prefer that, I'm not an advocate of just showing up all the time, but I always say to my patients, you didn't go to school, and if you get worried, and you're very concerned, especially mothers. When I was at school, my teacher used to say to me, do not ignore what the mother of a child is saying to you. For example, one of my teachers used to say, if a mother says to you, her child has a hernia, although you don't see it, the child has it, because mothers tend to be a little more meticulous and they look at their children a whole lot more than probably even the father does. So you always try to get the mother in. But I know everyone does not have to run to the emergency room if a child has 1 or 2 episodes of diarrhea. So Dr. Henry, what would you advise them to do? Because this is what people want to hear. What would you advise them to do before they get to the ER? And then what would you tell them? Hey, this is enough, go straight, don't do anything else. So what would be your advice to that mother or father or auntie?
All right, my advice to them would be try to hydrate the child at first, but if the child is vomiting, nothing at all, no water, nothing at all until after an hour and a half. I love to say an hour and a half. You know, just to give the stomach time to settle. Then afterwards you try again, but with nothing like no milk products, no dairy products, no sweets, no Coca-Cola, no Sprite. I know our grandparents used to say that, and I'm sure my grandmother is listening.
Yeah,
and she's going to deal with
Sprite.
me later on.
Can I ask, what about coconut water?
I know my grandmother is going to deal with me.
Dr. Lescott is asking about coconut water, but I know about the Sprite.
Yes, I know about the Sprite and the stuff, but, you know.
So that's a myth. So if you're vomited and you want to give your child something, no Sprite.
No Sprite, no colas. Okay? So, so you monitor the child at home first. No food, nothing at all, oral, for the next hour and a half. If the child continues vomiting, even after an hour and a half, and we give maybe a sip of water, anything that you have at home that is not milk, and the child continues to vomit, then you come to the accident and emergency for help. The child have diarrhea, 1 or 2 loose stool. Sometimes some parents would come to the emergency room. The child had a diarrhea yesterday and have another one, like a loose stool yesterday and have one today, you know. So then we would try to educate them that it has to be at least 3 or more within 24 hours. And so then you come to the emergency room if that child continues, especially if it's a child that is under the age of 1, because they tend to get dehydrated quickly also. So you come to the emergency room. But you start at home, no oral, nothing at all, because some parents, when the child vomits, then as soon after, they try to give them something because, you know, the child looks irritated, so they give them something.
So
no, you have to let the stomach settle for a while, at least an hour and a half, and then you start introducing fluids again. And remember, fluids.
Dr. Lescott was asking, like, coconut water.
Yes, coconut water.
And like Pedialyte, they were asking me about Pediasure, stuff like this.
Yes, those things could help.
One of them wanted to give the baby Gatorade for the electrolyte issue, and I was kind of undecided because the child was under the age of 1 year.
Okay, no, we'll say Pedialyte, all right, which is the safe way to go.
Safer one.
All right, so they give them the Pedialyte, but some persons don't have Pedialyte at home, but you give a little apple juice if you have at home, or you could give the water, you know, but the water doesn't put back electrolytes. That's what I want us all to do.
Exactly.
Water doesn't put back electrolytes. Some persons like to give oral challenge with water, but I don't recommend that because it doesn't put back the electrolytes. And so sometimes because some persons don't like water, so children don't like water, and so they vomit.
Oh dear.
Right? But you try those things at home at first.
So we're going to put a stick a pin in that right now, and we're going to take a break, and then we're going to come right back to continue our discussion about the stomach bug.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see, and the climate's changing. But hope is remaining. That we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are.
Okay, pleasant good night, and if you are just joining in, we are speaking about the stomach bug, and that the stomach bug is back. And this episode of HealthWise tonight came about because we are seeing an increase in the numbers of cases going to the JNF A&E, the Parkson Medical Center, and Mary Charles, and even to the private offices. We're having a lot of episodes of diarrhea, a lot of episodes of vomiting, and we decided, since it is out there, it is a hot topic in the health arena, we decided to come on tonight to educate you about diarrhea and vomiting, give you some tips before you actually go to a healthcare facility, and to let you know or give you more tips when you need to run to these facilities. Tonight in the studio, I have with me Dr. Lescott, and I also have with me our pediatrician, Dr. Henry. And so far, we have discussed the different causes of gastroenteritis, which is an infection of the stomach and the small intestines mainly. And we have looked at the non-infectious causes as well. We have given the signs and symptoms, and most times, or the most common signs and symptoms would be abdominal cramps, nausea, which can lead to vomiting and diarrhea. We spoke about the most feared symptom or sign, which is dehydration. And we know dehydration means when the body loses a lot of water, and the body is 70% water. So can you imagine losing that 70% or almost 70% water of your body? What would happen? Life in that body would cease to exist. So that is why Dr. Henry and Dr. Lescott, they paid special attention to this thing we call dehydration. Because if it's not managed well, it can lead to death, especially in children under the age of 5, and even more in children under the age of 1. So we looked at some scorings, and Dr. Henry, he explained it well along with Dr. Lescott. And if you don't understand it well, Dr. Henry is at JNF. You can always go there and look for him and have him explain it to you. I just put him on the spot right there. And he's a very good teacher. And there's Dr. Lescott now, who's at JNF as well. So anything you don't understand here, you can go look for them at JNF, and they can actually help you out on that. What we also have to realize is that this gastroenteritis does not only affect children, it affects adults. And if you had tuned in before, Dr. Henry, in his opening sentences, in his definition, he said that gastroenteritis can also affect a child and also the adult. So Dr. Lescott, in terms of the symptoms, are there anything different when it comes to the adult? So you can just give us an idea on that, please.
Well, we usually tend to try to be a bit more emergent with children, because I think we feel like adults, we can handle certain discomforts and accommodate to suit where children might not be able to compensate as well as adults. But we adults, we still have to take care of ourselves, and we still have to know when to hit the emergency button. So I will give you a few heads up on how, what we can look for in gastroenteritis in adults. We can look for things like if there's a lot of blood in the stool, or if the stool itself is black, if we have a lot of intense abdominal cramping or abdominal pains, any diarrhea with extreme thirst, especially if there is no urination for over 12 hours, that is very concerning and very serious. You really need to monitor your urine output. If you're not putting out any urine in 12 hours, at least you really need to see someone. Frequent vomiting, which does not slow down after 4 to 6 hours, of course, as Dr. As Dr. Yannick pointed out earlier, if you don't pay attention, you can become very dehydrated very quickly. If you're having severe vomiting, you really need to pay attention. Also, if you have occult blood in the stool, like if you have red blood color of the stool, any coffee grounds in the stool, meaning if there is any dark grittiness to the stool itself. You need to pay attention to that. And any deterioration of the general health, any weakness, any drowsiness, any irritability and confusion and general malaise, if you're not feeling like yourself, if you find that your cognitive functioning is declining, you're finding it difficult to focus and concentrate, then you need to see someone.
So as an adult, we just don't stay home, and sometimes we get that happening. So we get the extreme. The mothers running with the babies, and then the adults staying home. Because we have adults that come into us and they are severely dehydrated. We have to get drips up on them, as we say, and we have to even put them on the ward for a few days so that they can be rehydrated. Because as we were taught in school, when you're going to rehydrate somebody, you cannot do it in a fast pace. You have to let the body get accustomed to you putting back the liquid in. So sometimes we would have to put you on the ward for another 2-3 days to get you where you should be. So I want to shout out to my cousin down in Sandy Point there, Jeanette Woodley and Vaughn. So Jeanette asked Dr. Henry, what about the guava leaf and stopping the diarrhea? Now, Jeanette is such a big doctor, she said 1 leaf for babies. So what do you think about that? Gina, yes, I put you on the spot. And I also want to say hi to Beverly Benjamin too, who tunes in all the time, and Nadia Mills out there in the US who tunes in all the time. So what do you tell Gina about this 1 leaf for baby? Because I know there are some misconceptions around these, just like how I thought you could have given the Sprite. So what is going on with this baby and the guava? What do you recommend?
Well, one thing that we have learned is not to stop diarrhea.
Okay, good.
Right? We don't stop diarrhea because it is evident that something is wrong in the intestine region or in the stomach with the vomiting also. That is why I don't even love to give gravel unless it's severe. You know, a child that is constantly vomiting over and over. So we don't really give children any anti-emetic drugs or any gravel, as to say, to stop the vomit or to stop the diarrhea, because it is something that the body is trying to get rid of. And if we do stop it, then that stays there and proliferates. It multiplies and it gets worse. It damages the intestines. It causes perforation. And from perforation, then we know we have to call Dr. Woodley.
Oh, Lord.
So we really, yes, as my grandmother used to say, you know, you give the little guava bush and it would help those things. But I know my grandmother is going to give me a call later. But we really don't stop diarrhea, especially in pediatric cases. We don't stop the diarrhea. We let the process go. All we do, we hydrate the child. Unless there is bloody stool, as mentioned before, then that is when we intervene and we give antibiotics, because you know the bacteria itself now causing blood in the stool.
And that is something very important, and it's also a myth and something that I had to relearn as well. Because growing up, one of the first things my mother did, she would stop the diarrhea. She would try her utmost best. We did the guava thing too, and stop the diarrhea. And then there was a famous drug back in the day that we used to use. You take it and to stop the diarrhea. And when I went off to medical school, then, you know, my teachers at the pediatric centers and in general medicine, they told us that stopping the diarrhea is not the best thing to do. In fact, the latest literature says you let it happen. Because what the body is trying to do, the body is trying to get rid of whatever irritant that is inside there. And they say the caveat here, though, is to let it continue, but as you said, Dr. Henry, hydrate, hydrate, hydrate. So that is something that we have to pay special attention to. And even some of our colleagues too, you know, we quickly take the prescription pad and we write something. And sometimes what we need to be writing, instead of writing medication to stop the diarrhea, we should be writing things like Pedialyte, rehydrating salts, you know, tell them about the coconut water, give them the signs of dehydration, that if they need to go to the hospital, then they go to the hospital. So how can we prevent gastroenteritis? Dr. Lescott, what would you tell a mother coming to you, or a father? You know, yeah, I need to stop that, a father. What would you tell a dad who comes to your office and, you know, you want to educate him about preventing, you know, getting the gastroenteritis? What would you tell him?
Okay, well, first off, hygiene is of the utmost. Hygiene. You wash your hands as often as you possibly can, thoroughly with soap and water, especially after using the bathroom or changing a child's dirty diaper. You wash your hands before, during, and after preparing foods. Wash your hands before eating. Ensure that towels are not shared. Likewise, kitchen utensils and any other household utilities that might have high touchability, if that's a word. Keep your child at home. This is a big one. Keep your child at home if he or she has the gastroenteritis, in order to prevent the spread in the schools. Remain at home if you are an adult with gastroenteritis as well, to also prevent the spread in the workplace.
Okay, so that's good. Dr. Yannick, I have Sister Francis here. You know, Sister Francis, good night. Thank you for tuning in. And Sister Francis, she was just about to ask about she asked about the antibiotics. If you give antibiotics, which I think you just mentioned,
yes,
but you probably need to go over that. And Sister Francis has introduced something called comfort ball water. The comfort ball, those are the little white thing people put in clothes.
But they're poisonous.
Well, Sister Francis, no.
Oh my God.
But that is important, and I'm happy for the dialogue on WhatsApp here, because these are some myths that we need to debunk.
Yes.
So I'm happy for that, and I know she's probably just asking that for, you know, the general public, because we know Sister Francis, she comes in contact with many persons. That's Paula Francis, and so talk about that, the antibiotic and this comfort ball water.
I've never heard of comfort ball water.
Comfort ball water. We put it between clothes, not in your body.
Okay, great. So we don't do that?
No, we don't.
Okay, good.
No, we don't at all.
Okay.
And also the antibiotics, as I mentioned before, is really only given when there is bloody stool. When there is bloody stool, we give antibiotics alone, right? If the child doesn't have any blood in the stool, and the stool is just a normal colored stool, but it is watery, then that is when we hydrate, according to Dr. Woodley. But once there is blood in the stool, that child should be admitted for observation and to test to see what agent, bacterial agent or maybe parasite, that is causing the bloody stool. Okay.
I have some die-hard guava fans, guava leaf fans, people. I have Bernadette. Bernadette, good night. Bernadette Foy from St. Peter's. Thank you for tuning in. And these people are stuck on the guava leaf to stop the diarrhea. But, so you see what is happening here? We need to get a cultural shift right now. Because, you know, so this is where we have a battle between medicine and the culture. And as doctors, we always have to learn to find the balance between the two. Okay? So we just can't come in with our medicine. We have to look at the idiosyncrasies of each island, not of each village. Because we are now fighting against the grandmothers, the theories of the grandmothers, of the aunts, of, you know, the ancestors. Because everybody believes, let us stop the diarrhea with our guava bush. But medicine now is telling us, let the diarrhea continue, let it continue, let the vomit continue to a certain point, yes, but all we have to do is stay hydrated. In terms of the vomiting though, because you can get like upper GI, upper bleeding, we sometimes try to calm the vomit as quickly as possible, especially if it's exceeding beyond.
Excessive, yes.
Yeah, especially if it's excessive, we try to stop the vomiting. And it not only can cause bleeding from the esophagus or from the stomach, but you can get what you call bronchoaspiration, which is some of that vomitus going into the lungs and causing a pneumonia. And you know, the pneumonia is the cold that doesn't go away. So when it comes to the vomiting, we are a little quicker to move in and stop it. But when it comes to the diarrhea, we tend to pull back a bit, but we just hydrate. So for all of your guava leaf fans out there, I hear you. I hear Granny. And I hear Grandpa.
Yeah.
But that is a myth. That is something that science says that we should not do anymore. Okay? So how do we stop the spread now of gastroenteritis? Dr. Lescott, I'm going to pick on you on this one again. A mother comes into you, a father comes into you, and you want to teach them. Because as doctors, we have to teach. We have to teach. A doctor is not just to sit down, somebody comes into your office, and even before the person sits, you start writing a prescription. No. We have to educate. We are teachers. So what would you tell that parent as it relates to the spread of gastroenteritis?
Okay, well, I would also try to inquire about the water quality. I would also try to encourage that mother to boil any water that they're going to give the infant to consume, especially even if it's ice cubes. You make sure the water is contaminant-free by boiling it, which is the most common way. You wash your fruits and vegetables very thoroughly as you can. I know of some persons that would soak fruits and vegetables in a bit of apple cider vinegar, and that usually tends to get rid of any things on the surface of the fruit itself or any little parasites. Also, avoid eating any raw or undercooked foods, giving the children any raw or undercooked foods. I don't think that's part of our culture in St. Kitts anyway, to eat undercooked foods, but we have to put it out there still. Avoid any contaminated food. If you're traveling, you have to be careful about buying foods off the street and stuff like this. If there is no water and soap to wash your hands thoroughly, you can use an alcohol-based sanitizer. Right?
Okay, and something that I want to also underscore, sometimes when we travel, we buy the bottled water, but then we go to the sink and we brush our teeth with the water from the tap.
Yeah.
It doesn't make any sense.
Counterproductive.
Oh, yeah, that's counterproductive. And it doesn't make sense. So if you are going to a strange country or a foreign country and you're going to buy your bottled water, use that same bottled water to brush your teeth. And when you go into the bath and you plan to sing, you plan to do your Tina Turner singing inside here, make sure no water from the pipe, from the tap, or from the shower cap goes into your mouth as well, because that's counterproductive. If there's any bacteria, anything inside there, it gets into your system by singing and having that water going into your mouth. So Dr. Henry, Sister Paula again asks about somebody who is breastfeeding. What do you tell? And that's a very good question. A mom who is breastfeeding only, the first 6 months should just be, breast milk, and that child has diarrhea. Very good question. What do you say to that mom? How does she prevent the dehydration in that child who's only being breastfed?
Well, a child that is breastfed alone should not. It is rare that they get gastroenteritis. Why? Because the breast milk has elements inside of it that prevents and protects the gastric tract from any type of bug.
So we should produce it on a mass scale, and we can have that as a preventative for other patients. We produce breast milk on a mass scale, right?
But that is important, and that is where we have to push the breastfeeding exclusively for the first 6 months.
Yes,
I love that point.
As long as you can.
As long as you can.
But there's sometimes, that a child may, it is rare, but may have gastroenteritis. You never stop breastfeeding. Because the element is inside of the breast milk that will also fight and helps to fight against it. Because the breast milk is the first vaccine, the first antibiotics, the best antibiotic. It helps the child, it helps the mother also. So we don't stop breastfeeding. We continue the breastfeeding, all right? Because it helps to rehydrate the child. But a child that is not totally breastfeeding or exclusively breastfeeding, then that is where we have the problem. Because the formulas, they contain lactose. And once a child has diarrhea or vomit, that lactose will eventually, as is one of the causes, non-infectious causes that prolongs diarrhea. The lactose that is in that milk will cause the child to still have the diarrhea. That's why sometimes when patient comes and they have the diarrhea and they they are on formula, I would always say get soy milk, lactogen soy, Infamil soy, any types of soy milk, because it doesn't have lactose inside of it, but it helps to keep the child hydrated also. Okay, but that's a good point. Breastfeeding should never be stopped.
And they shouldn't give the...
So should the mom actually like take in more liquids? Because I think what the point needs to be driven home here is that the child will not be dehydrated on the breast milk.
No, it
will not
be dehydrated on the breast milk.
And it would be sufficient even though the child is having vomiting and diarrhea.
Yes,
it would be sufficient. And the mom doesn't have to go and drink up a whole 2-3 gallons of liquids.
No, and the child may not even need any antibiotics because, as I said, the breast milk has all the elements inside of it because it is the first antibiotics and its first vaccine.
I wish I had all of this when I had my daughter. You know, I just winged everything. I didn't know what I was doing, and now I'm old, so that stage of my life has gone. Okay, so that's very interesting. So if you want to be a part of this discussion, the stomach bug is back. You can see the numbers at the bottom of the screen: 466-2666. You have 662-8674. You have 767-4765. And we have our overseas line, which is 1-239-645-4500. At this point, we will take a break and we will come right back. So stick and stay.
What did you mean earlier about climate change, Mom?
Well, when I was your age, I remember beautiful coral reefs and healthy beaches. The summers weren't as hot as they are right now, and the rainy season meant that it only rained when it was supposed to.
And then what happened?
The weather just started to change and storms got worse. Coral reefs started to die because the ocean was getting too warm, and crops started to die because there was not much rain. You know, we realized as adults that we were doing something that was causing this.
What were you all doing?
The same thing we're doing now. Not using clean, renewable energy, chopping down too many trees, and even polluting the air with gases such as the gases emitted from our cars when we drive around.
We need some help before it's too late, Mom.
We can't let it get worse.
What can I do? We can raise our voices.
With 35 million dreams, aspirations, and futures at risk in CARIFORUM, we need your voice in our story against climate change. Acknowledge, commit, act. This message is brought to you by the Caribbean Community Climate Change Center under the Intra-ACP Global Climate Change Alliance Plus program and is funded by the European Union.
Pleasant good night and welcome back to The Stomach Bug is Back by the St. Kitts Nevis Medical and Dental Association. I'm your host, Dr. Woodley, and if you're just tuning in, I'm so sorry, but you have missed a great discussion as it relates to the vomiting and diarrhea, something that has increased in the past few weeks in our federation. In studios with me, I have Dr. Henry, our pediatrician on the island here of St. Kitts, and I have Dr. Lescott, general practitioner, coming from the Taiwanese system. And I want to thank both of them for being here with us tonight. So far, the discussion has been very dynamic. We have gotten quite a few tips. We have gotten quite a few suggestions, quite a few questions from those persons who are listening via television and would have sent their questions to us via WhatsApp. Gastroenteritis, it can affect both children and adults. It is normally hallmarked by excessive diarrhea and vomiting. And one of the feared complications, which I have mentioned before, would be dehydration. That is the most feared complication, and if not managed or treated correctly, can lead to death. So we are now going to look at how the gastroenteritis, how this is spread. And Dr. Lescott is going to go straight into it. And she told me something very interesting, that she worked at a preschool. Where Dr. Lescott, you are an all-rounder. I mean, you have a lot of tricks up your sleeves that you worked at a preschool. And you were speaking to us during the break, you know, the things that that preschool did to prevent the spread of gastroenteritis. So just elucidate a bit for us. and
Sure.
let our listeners know?
I mean, I don't think we have this problem in St. Kitts when it comes to cleanliness and hygiene, but just to put it out there, if you have like small children and they're, you know, more than one persons in the household, you know, children, they tend to touch everything. What you can do, for me personally, when we were working at the preschool, we would just lightly spray the toys or the play area, the playstations, and all of these small little touchy areas, because they're at their height. We spray around that area, whether it's the knobs of the cupboards, anywhere that we suspect that a small child is tall enough to put their hands, we will spray some Lysol. So then in the evening, we just spray everything, and then everything is disinfected overnight. So in the morning when the children come back to school, everything is disinfected and clean. So I think that's a tip and a helpful pointer for some parents. If you have a lot of small kids in on a home, you can prevent the spread much better by just doing those little things. I just needed to put that out there.
And there's some other things that we can do, Dr. Henry, in terms of, you know, preventing the spread of gastroenteritis. And this is actually similar to the whole COVID thing too. Hygiene,
Yes.
hygiene. So let us have some more ways we can, you know, curb the spread of the gastroenteritis, Dr. Henry.
Well, to prevent the spread of gastroenteritis, you wash your hands often, get hygiene practice, good hygiene practice, essential. Keep objects and surfaces clean, as you said, just like COVID, because it's a virus you're dealing with, so we have to also do the same thing, but we don't wear the mask, but we do everything else. You know, you keep objects and surfaces clean, especially those that come into contact with the infected persons. Wash fruits and vegetables thoroughly. Remember the importance of safe food handling. And also, you wash hands before, during, and after preparing meals. Wash your hands before eating. Ensure that the towels are not shared, likewise kitchen utensils. Keep your child at home if he or she has gastroenteritis, in order to prevent the spread in schools. And also there is, you know, the children love to go to the pool. So you keep your child or children at home if they have gastroenteritis from the pool. Because, you know, sometimes it's watery diarrhea, and sometimes a child doesn't even know that it's coming. And so it leaks into the pool, and because the water is there stagnant, not moving, then it could contaminate the water and also spread to other persons, adults and children alike, in the pool. Okay?
So that is important, and even because, you know, when persons are in the pool, they go under and they drink the water.
Some water.
That's why I don't like to bathe in pools, because, you know, pools don't clean themselves. Somebody asked a question, this one just threw me out the door, about drinking marijuana to stop the effects of diarrhea. That I don't know, but as we are preaching, we don't really stop the diarrhea anymore. We just hydrate. So I don't know if any one of my panelists know anything about the marijuana and
For the diarrhea,
and for diarrhea or vomiting.
Well, in pediatrics, we kind of give marijuana, that child will get high.
So no, and they're also asking if it can also influence diarrhea. Not quite sure as well. I guess that's something that we would have to look up. I mean, we are here to learn as well. We don't profess to know everything. So that was a good question, and we would have to
see if
we would have to look it up as well.
Marijuana would make the intestines, the parasympathetic reaction. I would have to see if that would cause some sort of, because I've never had that correlation. I've never heard of that before.
Okay. And so to prevent the spread of the gastroenteritis, as you saw, it's just about hygiene. And if one thing COVID has taught us, one of the good that came out of COVID was, you know, the washing of the hands, the hygiene, the wiping down of the knobs. We saw the importance of doing so. So I want to believe we probably have that down packed by now, but it never hurts to reinforce, you know, what we have learned before. So in terms of the treatment, Dr. Henry, I mean, we have, you know, walked around it quite a bit. our callers, well, our WhatsApp questions pushed us into the treatment long ago. But just to go through quickly, how do we treat gastroenteritis?
Well, it is supposed to be supportive and aim to avoid the main complication, which is dehydration. So you hydrate the child, or you hydrate yourself as an adult. And in children, I always like to start with the apple juice, right? To rehydrate the child, I give them some apple juice instead of the Coca-Cola or anything else, or the water itself. And sometimes the oral rehydration salt, right, for the adults doesn't taste well. So if you give it to a child, that child will spit that out, and you will think that the child continues vomiting, right? So that's why we say in children, you go to the Pedialyte, you give them the apple juice, not the whole juice or the whole Pedialyte. Right? You give, if a child is under the age of 2, you give them 2 to 3 ounces. And a child that is older, then you go to 3 to 8 ounces.
Are children allowed to have coconut water? I think I asked before, I wasn't sure what you said.
Yes, they can. Allowed? Yes, coconut water would also help the child. And parents, patients are encouraged to drink plenty of fluids and can take paracetamol if there is a fever and or aches and pains. Additionally, antibiotics is given, as mentioned before, if it is a bacteria that is causing it. And how do we know it's a bacteria? When we have blood in the stool. And drugs to kill the parasites if it is a parasite that is causing it. And you know the most dominant parasite that we have here in St. Kitts and Nevis is the Giardia. And sometimes that doesn't cause bloody stools, but it provokes diarrhea. Because there are some persons that, you know, can't afford the bottled water from Island Purified Water all the time. And so they use other sources like, you know, the Alcatel, all those kind of stuff, you know. And so they can't afford it. And so sometimes they go to the tap water and they drink that water. And sometimes when we have a lot of rain, you know, because our water source reservoirs are in the mountains, sometimes the rain itself contaminates that water, especially during hurricane season. It's contaminated. So that's why during hurricane seasons I always tell parents, you know, try to boil your water as often as you can. You boil the water, even if it's Island Purified water. Sometimes I say to boil it. Some persons would ask, but it's Island Purified. I said okay, but still boil the water just in case, you know. So you do those kind of things. For the drugs to kill the parasite, we use the metronidazole here on island, and also avoid anti-vomiting or anti-diarrhea drugs unless prescribed or recommended by your doctor, because these drugs will keep the bacteria or the infection inside of your body. And what we need to do is to get rid of it. Okay, so we avoid taking those things. And as Dr. Woodley stated before, yes, the vomiting, you know, sometimes it provoke us to give the gravel or to stop the vomiting. But the diarrhea, we allow it to do its course, but we hydrate the child, or you hydrate yourself as an adult.
Okay. Quick question. Yes. Do we have a broad spectrum that's suitable for infants?
For infants,
do we have broad spectrum antibiotics that's suitable for infants?
Yes, we have the broad spectrum. Children really under 6 months that have sometimes, even if they have the UTI and they have the diarrhea, you could give the ceftriaxone. Okay. All right.
Okay, we have Dr. Romani, our pediatrician in Nevis. She's actually listening and enjoying the program as well. And she just chimed in and she said, yes, marijuana actually influences diarrhea. So for the person who sent me that message about the marijuana, that was the answer, that the marijuana actually influences diarrhea, so it causes diarrhea, the marijuana. So you have to be careful with that as well. And she also stated in terms of the treatment, this is Dr. Romani out of Nevis, that you have to avoid the sugary foods.
Yes, all of those.
Yeah, the sugary foods, because the sugary foods would cause more water to come into the intestine, and then it would actually prolong the diarrhea. And things like zinc and folic acid can sometimes be used actually to help with the regeneration of that brush border that we spoke about earlier to actually help with the reabsorption of liquids and hence decrease, the duration of the diarrhea.
Yeah.
Okay, so, and another patient asked, what about the orange juice? Is orange juice good to take during, when you're having episodes of diarrhea? No. Any one of you?
Well, the orange, once a child has diarrhea, we said no guava, no banana.
Oh, yeah.
But we could give the orange juice, we could give the pineapple juice, that would help to soothe them. But if the child has vomiting, not eating anything, the stomach is already producing acid. And so the orange juice is acid. So acid on acid will cause
more
abdominal
irritation.
cramping.
Abdominal cramp.
Right? So if that child doesn't have the vomiting but has diarrhea, then you could give the apple juice, the orange juice, that would help also.
Okay, so if you look at slide 16, can I get slide 16 because I'm seeing this brat diet. I was to ask you about
banana,
that.
rice, applesauce, toast.
Do any one of you promote that to patients? The banana. Well, you just said not the banana.
Yeah.
Rice, applesauce, toast.
The applesauce, I love to give the applesauce, and I know the A&E physicians, when they know that they're calling Dr. Henry for a child that has vomit and diarrhea, then Dr. Henry would say, okay, make sure that the mom or the dad could go and buy an apple juice or applesauce. But then they would say, Dr. Henry, look at the time. I said, the gas station is open still.
Okay.
So could you help, please, or something? Because the applesauce, the apple juice helps to soothe the stomach itself. And, it's not the type of sugar that we use that that the sugar reduces, that we cause the diarrhea to prolong.
Okay.
The applesauce has that type of sugar that is
It's not sucrose based.
not sucrose based, right? At that time for the child. So it helps to soothe the child. And after giving the oral challenge with the applesauce, then the child wants a lot more. Right? Okay. So.
And something as severe, which is rest. I didn't hear anybody talk about rest.
True.
Stay home and sleep, watch some Netflix, rest and rest. And sleep as much as you can. Okay, that part up my alley. Okay, so we're going to take a break and then we're going to come right back to wrap up. And it has been fun so far, and we want to thank those who have sent their questions to make this whole show so much more dynamic and so much more interesting. So stick and stay.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing. But hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
Welcome back to HealthWise, and the topic that we have discussed, yes, past tense, so you would have missed most of it, is the stomach bug is back. I am your host, Dr. Woodley, and in studios I have with me on my right, well, on your left, I guess at home, Dr. Lescott, and I have Dr. Henry, pediatrician, and Dr. Lescott, general practitioner. So we looked at the stomach bug because it is something that has risen in the past few weeks here in the Federation. So we thought it was best to come out and enlighten you as to what is going on, give you some tips, and let you know how to manage diarrhea and vomiting, and if you cannot manage, where you need to go. So we looked at many things, and you can always go back to the YouTube channel and get this episode of HealthWise, and you can sit down with your popcorn then and listen and digest everything properly. So we're basically wrapping up, and somebody sent me a question about home remedies, and interestingly enough, that's our last slide, slide number 17, about home remedies when you have diarrhea and when you have vomiting. So any one of you, the panelists, if you want to get into these home remedies for the stomach flu or the stomach bug, feel free and engage the listening audience. So I'm seeing the ginger tea.
I was about to say that's very good. Like, it's usually, for me, it's a soothing effect, but I'm not sure about children, how they would like the ginger tea. I know it's a bit of a burning sensation. I'm not sure how children...
But they would tolerate it, those that are older than 1 year of age.
Okay.
So the ginger tea we can... So what is exactly... But it doesn't substitute you hydrating.
Hydrating.
But it's just to soothe.
Soothe, just at home.
At home, just to
remedies
soothe.
To soothe yourself, everything, especially in the adult children, as we call them, those that are 12 years and up.
Oh, yeah.
The adult part.
Okay, like the teenagers. Yes. Okay, and the adult population.
Adult population.
Okay, cool. What I'm seeing here is this probiotic yogurt. I'm seeing that over there in that left hand, well, my right hand side. That probiotic yogurt, and that's a big market thing now.
Yeah.
Because you go supermarket, and all the yogurt, them saying probiotic. We should really test and see if they really have probiotic inside here. Yeah. So what are your thoughts on this, the probiotics? Because I normally would prescribe it when I have persons who may have diarrhea for quite a while. I give the probiotic, I give the zinc, I give the folic acid. What are your thoughts on the probiotic? Does it really work?
I guess it does, especially in children, because in Cuba, we don't have the formulas like we do. So the Cubans make the yogurt, and it's probiotic.
Okay.
And so we always give children those things, even in the hospitals, because they can't afford the formulas, and so they substitute it for the probiotic yogurts, and it helped the children a lot instead of the formula that we have here. Because the formulas that we have here, they are very heavy, but this one it's not as heavy as.
So you explain to the people the probiotic is to basically put back the good bacteria that was lost in all of the irritation and all of the stooling. A lot of the good bacteria of the gut would have been compromised or maybe lost altogether.
Yeah.
And so the probiotic now would replace some of that good bacteria to return the normal flora. That's what you call it?
Yes, the normal flora.
Normal flora, the intestine. Yeah.
So that is very important with the probiotics. So I normally just prescribe it because in pharmacies you can get it in like a tablet form, some powder form. So I would normally prescribe the probiotic, and it, as Dr. Lescott said, it puts back the good bacteria into the gut. Yeah. Okay, so that flourishes, kills off the bad bacteria. It allows the brush border of the intestine to go back and helps with the absorption of liquid, hence decreasing the diarrhea. I see one of my listeners say she loves the home remedies. That's all she does. She ain't taking on nothing else. And, and the one from SP, so you don't know. So, yes, what about the apple cider vinegar? That, again, what are your thoughts on that?
For me, I think it kind of follows the same principle that Doctor pointed out earlier. If the child or adult has severe vomiting, I would not definitely suggest using apple cider vinegar because it's too acidic. It's going to, I think, exacerbate the irritation of the stomach. So I think maybe if the person might just have diarrhea alone, but maybe not so much with the vomiting.
Okay. I'm seeing our pediatrician cross the waters, cross the nows, just said to me that carrot drink actually soothes the bowel movements in diarrhea. So I want to kudos, Dr. Romani, on that. She said, you know, you can get the carrot drink and do not go to the store and buy the carrot drink.
No.
Make it
Make it
home.
yourself.
Homemade
Make
remedies.
it home. That's what we call it, homemade remedy. So you don't go to the supermarket to get a homemade remedy. Make it home. Okay? So that's a very good tip that I didn't know either. And she's also advocating, if you have anybody who is into the pharmaceutical business, that we can also get the probiotic as a liquid form as well.
And they have
which
the
is
tablets.
better. They have the tablets,
They
but
have
the
the
liquid
capsules,
forms
yeah.
The capsule?
would also, you know, help, especially for those the younger population to take, especially. Okay, so that was very, 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 very good. All right, so I'm going to have you doctors, because we are coming to an end, and I thoroughly enjoyed this discussion. When Dr. Henry approached me about diarrhea and vomiting, I was like, what else I can learn about diarrhea and vomiting? And trust me, I did learn a lot. So that goes to say you should never cap yourself. There's always more to learn. And as long as you're living, you should be learning something new every day. So I'm really grateful. I mean, I've learned a lot, and it will help me when I'm interacting with my patients as well, because I see patients from surgical to non-surgical cases. So this discussion actually helped me tremendously. So doctors, wait, I'm seeing, okay, no, I am going to ask you to wrap up this part of our discussion as we are coming to an end. And wrap up, let the public know, what to do, and then we would close the show tonight. Okay. So we will start with you, Dr. Lescott, and once again, I want to let the listening audience know, on the viewing audience know as well, that Dr. Lescott, she just filled in at the last moment because Dr. Pemberton, who was supposed to be here, he got sick and he could not make it. So I really want to thank Dr. Lescott for stepping up to the challenge, coming out and helping out the situation. And we greatly, greatly, greatly appreciate that.
You're most welcome.
So please do your little wrap-up talk, and then we go to Dr. Henry next.
Sure. Well, as Dr. Woodley pointed out in the first 15 minutes of the show, hygiene, hygiene, hygiene. Wash your hands before and after you eat. Sanitize the play areas of the children, and hydrate, especially if the child is under, I would say, the age of 2, right? We hydrate as much as possible. I don't want to say everything. I would like to leave some for Dr. Yannick to say as well.
You can't say everything.
I did say everything.
You can't say everything.
Well,
all right.
Yeah.
So to wrap up, as we know, gastroenteritis, that's the stomach bug, or stomach flu, or intestinal bug, that as we called it. It's out there in our communities, and it's like a plague right now because it affects children and adults alike. That is why, as Dr. Lescott said, it is very important, the hygiene of every single person in the household. If your child is sick, you keep your child at home. At home. Some persons, even though they will give their child some little medication and send them to the school, but you keep them at home because this can pass person to person by contaminated toys, utensils, and even the very water, even if they go to the pool. So you keep your child at home. And also you hydrate yourself properly at home. You give your child oral rehydration challenge, which is you test them orally to see if they vomit. If they vomit continues, they have 3, 4, 5 vomiting, even though after an hour and a half you stop giving them anything to eat, then they vomit again after, then that is when you go to the accident and emergency room so that child could be hydrated. The signs to look for in children, especially in children younger than 1 year of age or 12 months, you start from head to toe. You look at the soft spot once it is sunken in, and you look at the eyes if they are sunken in also. You look at the mouth. You look at to see if the child has tears. You see if the mouth or the saliva is very thick. Also, you do the skin torture, which is, in elderly patient, once you pinch their skin, it doesn't retract quickly. So in a younger child, once that is happening, then that child is dehydrated and it is time to go to the hospital for help, or to your medical practitioner for help. Okay? Gastroenteritis could lead to dehydration. Dehydration could lead to death. So it is very, very important to note. And there are home remedies, as we have mentioned. You have the ginger tea, you have the probiotic yogurts, you have the carrot juice, you have the apple sauce. These things that you could do at home before rushing, or to prevent dehydration of yourself or of your child or anyone that is at home. Thank you.
Okay, well, guys, you got a lot of thumbs up here. Sister Francis, said good job. And this is great. This is exactly what the show is about. Letting the public see our doctors, interact with our doctors, let them know who we have in the Federation that they can go to. So this is very encouraging, and a lot of love and congratulations went out to you guys. Even the Prime Minister is tuned in.
Oh, wow.
So, I feel good. All right. So, and he says he's actually enjoying the show, awesome. And he sends his support as well.
Thank you.
So, I must say, and I also want to thank the guys from ZIZ in the studio there.
Yeah.
I must say, many nights when I'm done, sometimes I don't thank them, but I'm not going to forget tonight. I want to thank you guys so much for being here with us and bearing with us. We truly appreciate it. The SKNMDA, we appreciate you and we thank you for that. So, everyone have a great week, and thank you for joining us tonight for another edition of HealthWise. The stomach bug is back. Have a safe week all, and good night.